Thank you all for joining this morning. We have our Indiana and Kentucky consultant connection. So we are excited to have a conversation with those of you here. I know that we have communicated with several of you over the few years. So we wanted to give you a quick update on things Marathon and how we can continue to support our consultants in the Indiana and Kentucky area. Let's go ahead and move on to the next slide, and I will kind of give you a high-level overview of what we're going to cover today. So we will kind of level set to get things started, talk about the healthcare landscape as it is today. We will give a quick overview of the Marathon Health team structure, as well as some updates about the organization, review some of our models and services, and give you a little bit of sampling of our network pricing. And then we will follow it up with next steps for any new opportunities that you might have for health center services. And then we'll end it with some Q&A, see what questions you have and how we can answer those. So the team that we have with us today, I'm Keisha Burleigh, I'm the VP of Growth for the Midwest. We also have Allie Wiedow with us, who is the Director of Sales for the Midwest. Jennifer Smith-Gonzalez, who is our Group Vice President for the Midwest over operations, and Greg Howe, who is the Vice President of Client Success for our network sites. So we thought we would start things off with a little bit of fun. I know it's super early in the morning, and so while you have your little cup of coffee, let's get those brain signals triggering on all levels. So we want to start with a little bit or a few polls to get those brains working. First poll here: which of the country's entire national GDP is smaller than the amount the U.S. spends on healthcare? This can be a multiple selection. So which do you think their entire national GDP is smaller than the amount the U.S. spends on healthcare? Give you a couple seconds to get that brain working. Interesting. Okay. Got most everyone who has responded. Get a couple others to get their responses in. Okay. Here are your results. So we have 60% have chosen Japan, 40% Germany, and 80% UK. All right, Leslie, Leslie is manning the slides here for us. So let's go to the next slide and see what our answer is. Actually, we don't have the answer on the next slide. I will tell you the answer. The answer is actually India, Germany, and UK. So those three countries, their entire national GDP is smaller than the amount the US spends on healthcare. It's kind of a fluke. Japan could fit into that category as well. Their GDP is about the same as what the US spends on healthcare. So that's about equivalent. China is the only country whose entire national GDP is higher than what the US spends on healthcare. So that's pretty eye-opening. On this slide, you can kind of see a little bit about how much these countries spend on healthcare, and then also how that correlates to life expectancy. So I'll just call out a few here. You can see China, for example. China, they have lower health expenditures and fairly good life expectancy of 78 years, which is about the same as the United States. Look at, let's see, Germany. They spend a little bit more on health expenditure per capita, and they have over 80 years life expectancy. The United States is off the chart. So you can see the healthcare or the health expenditure per capita for the United States is over $10,000 and life expectancy about 78 years. So we are have a lot of work to do. And I think that's why we're all here and interested in this topic. So we can work to not only get the health expenditures down, but also extend our life expectancy and quality of life. Leslie, if you want to go to the next slide. Um, this one is also looking at the US. So we spend a lot on healthcare, as the previous slide showed. However, the United States, they have sufficient access to primary care. So you can kind of see here that adults without usual source of healthcare, 28.7, children without a usual source of healthcare, 13.6. So that is, 80 million Americans not having sufficient access to primary healthcare. So I think this is where Marathon Health can come help and provide that access is really what our focus is as an organization, providing not only high quality, but also access. Okay, poll number 2. Hope your brains are turned on now. Which healthcare services have evidence proving higher use results in lower healthcare costs? This could be a trick question. Okay, we got about 55% responded. A couple more seconds. We'll give you a minute. We're at 45 seconds. So you got about 10 seconds to get your answer in. Okay, not a trick question. The answer is, in fact, primary care. So, primary care is a healthcare service that has proven evidence that more primary care results in lower healthcare costs. So this plays right into the conversation that we're having today. Leslie, you want to go to the next slide? Okay. So here are some stats about that specifically. Patients with good primary care access report better physical health and better mental health. Patients who visit primary care providers on a regular basis also have 16% lower hospitalizations and 15% overall lower costs. Every 10 additional primary care per 100,000 increases life expectancy by 2 months. So you can see here, spending more or making a higher investment in primary care leads to not only overall health improvements, but lower costs and greater life expectancy. All right. So the advanced primary care approach, in addition to just general primary care access, advanced primary care really aims to take it to the next level. I know many of you on the webinar here are familiar with Marathon Health, the services we provide, and how that differs from traditional healthcare. But I'll quickly kind of reinforce what some of those differentiators are. First of all, we want to our main focus is improved health outcomes. The traditional fee for service, that model is driven by volume. Those providers are incentivized really on the number of patients that they see or treat versus the outcomes of those patients. The advanced primary care model with Marathon Health, we provide additional time with our providers that they can really dig into their health behaviors and things impacting their overall health. And so ultimately, that additional time helps to reduce reliance on medications and specialty visits that are higher cost and reducing the overall health spend and a better experience for patients and lower costs for the employer as well. Okay, so all of this boils down to the United States does an overall poor job of making an investment in primary care. You saw from the first chart in terms of health expenditures related to life expectancy and some of the other slides that I've shared just previously. If you look at other developed countries and their lower healthcare expenditures, one thing that you will notice is that those countries spend twice as much than the United States on primary care. So this is where I think organizations are starting to really focus. Employers recognize the fact that if they do a better job of providing access to high quality primary care, they can ultimately drive down their healthcare costs and have the ability to invest that within their organization and within their people. Marathon Health has demonstrated several results in the effectiveness of this model. Leslie, if you want to go ahead and click through the 4 different quadruple aim areas, this model has proven with Marathon Health that we have high provider retention of 90%. So this really is important for the continuity of care of the patients that we serve. And therefore, that also lends to a really great patient experience, 95% reporting their experience as excellent or good. Our patients spend an average of 30 minutes with a provider, and we understand and recognize as part of this quadruple aim that if we do not get individuals engaged in our services, we are unable to be successful in the other areas related to health outcomes and healthcare costs. So Marathon Health, especially for employers that follow our best practices to drive engagement, we see 73% engagement in our services. And I think what's even more important than that is the average number of visits per year per patient, which is close to 3.5 per year. So this is very much a high touch model to ensure that we are being successful on driving those outcomes with patients. We recognize that it's not sufficient for patients to only come to see us once a year, especially for those that are working to manage chronic conditions. This has lended itself to better health outcomes. So in Marathon Health, our book of business, 67% of engaged patients improve at least one or more biometric markers. And we see a 19% reduction in ER visits. And then ultimately that leads to reducing healthcare costs. So 42% less spend in ER and inpatient costs for engaged patients. And then if we look at 2 different cohorts in our book of business, if we look at a cohort of those that are engaged with our providers at least twice a year, compared to patients that are not engaged in our services, we see that those that are engaged are about $1,800 less per year than those who are not engaged in our services. So this really does speak to the impact our services can have on reducing healthcare costs. All right. We wanted to take some time and introduce you to some teams that you might have a relationship with or connect with as we partner together. We want to make sure you know who you're speaking to. And so our growth leaders on the sales team for the Midwest, we have Kristen Vargo, who is the regional VP of the Midwest. Myself, focusing on the groups that are over 1,000 lives in the Midwest for Indiana, Kentucky, and some of our surrounding areas. And then Allie Wiedow, who I introduced earlier as our Director of Sales. She focuses on our opportunities of about 250 to 1,000 members. We also have solutions available for members less than 250 lives as well. So if there are opportunities for smaller employers looking to provide access to advanced primary care services, please reach out to us and we'd be more than happy to help support you in that area. I'll hand it over to Jennifer, who can introduce our operating teams.
Yeah, thanks, Keisha. Good morning, everyone. So to introduce our East operating group leaders, we have Daniel Stafford, who's our Senior Vice President for the East. And myself, I'm a Group Vice President for the Midwest. Nice to meet you all this morning. I have a team of group directors working underneath me to help manage all of the operations and the client expectations. So we have Kathy Jarvis in Northern Indiana, We have Tracy Barkley, who helps support all of our network sites. And then we are in the process of hiring and transitioning on a new group director who is going to focus their time around partnerships. So I have a team of regional operations managers and client success managers that report into me that help support the Midwest. And I work in conjunction and in tandem with Greg's team to just ensure that we have a client advocate for all of your clients, that we're thought partners together, and that we're strategizing year over year on how to drive engagement, how to support wellness initiatives, and to try to touch as many lives as we can and provide this type of advanced primary care relationship. Greg, I don't know if you've had anything you'd like to add there.
I think you've got it. We work collaboratively, and there's a lot of communication going on back and forth just so we can make sure we're providing the value and the patient experience all of our clients expect.
And then Leslie, if we can move over to the next slide, I get the fun job of sharing some of our successes with all of you this morning. So with our expanded network footprint across Indiana, we've been able to expand access to 3 of our Midwest clients: First Financial Bank, Indiana University, and Thompson Thrift. So we're really excited to be able to provide additional access points for their membership. We've got a municipality group with us. They were in year 1. We had 65% engagement in year 1. That's fantastic. And that is our city of Carmel. We have 81% of our members in the Northern Indiana education clients have had more than 2 visits. We've recently celebrated 4 years with Brotherhood, and we're seeing that they average close to 4 visits over the course of the year. And it's just amazing the work that we get to do with these clients. It's so exciting. We're in year 13 with CNO, and we just in year 13 alone, we saw 2.3 million in potential savings with that group. So just really excited to be here today, share some wins with you. Leslie, if we can go over to the next slide, I am going to share a very big win for us internally. We're really excited to share that we have completed our migration. So we kind of merged Everside and Marathon together in all of our clinics across 3 waves of a migration, and our last one just ended in February. So we are 368 health centers strong. We have a little over 1,200 teammates, and we're servicing close to a little over 360 clients. So just really excited about the wins that we've had over the past year, that we're kind of come together and we're all on one platform now. Can't wait to now move ourselves into a state of being able to provide some additional enhancements to all of you and your clientele. And just really happy to see the growth that we've had across the organization. So thank you. And I'm going to turn this over to Allie just to give us some education on the types of models that we have. So Allie.
Thank you. Good morning, everyone. So if we take a step back, thank you for sharing so many of those successes, but let's take a step back and understand just the models that Marathon Health can provide, and how we partner with you all as our consultant partners to figure out what's the right fit for those employers to drive those outcomes that Keisha mentioned. We feel like having the right access is really where it begins. So I'm going to start on the left side with the partnership model. You all are probably very familiar with this model, where we have an actual physical health center on site at an employer's location. So this is going to be a large centralized workforce. Think a manufacturing plant, think a large office building, things like that. And that pricing structure really is dependent on that staffing model. So we look at that at a fixed annual or a monthly fee, again, based on the staffing model. And really in the partnership site, that's where the solution can be a little bit more flexible. That's the employer may have some unique occupational health needs. Maybe behavioral health is extremely important to them. And we see that in their claims data that may be a need. So that's where we really can work together to understand all of those different levers and plug them into one centralized health center on site. Moving forward, we do have a hub and spoke model. So this model is a shared solution where a mid-sized to a larger workforce may have a site on site, or they may have a site, down the road where they say, we want to have a health center. We want to create this solution for our population, but we are willing to have sharing partners. And so they may invite other people within their community, or look to Marathon Health to go and find some solution or some partners to join that. And so that is a shared site. So multiple employers are using that site. And that pricing model is a PMPM typically, but may include an access fee into that health center. And we can help you walk through that. As many of you may know, we do have quite a few hub and spokes within Indiana, so we can help you walk through that solution moving forward. What may be a little newer to some of you is our network solution. And our networks are freestanding health centers that Marathon Health takes on the risk to own, to operate, to control the staffing. We fix the toilet issues, the plumbing, all of those different things. And this is a great solution for those who maybe have a distributed workforce or a smaller workforce that maybe cannot afford to have an on-site health solution, or it just doesn't make sense. So that pricing model is a tiered pricing, where we'll go through that a little bit later. I'll give you some insight into what that looks like, or a flat PMPM. So we really want this model to be accessible to the community. We'll talk about it in Indiana and what that looks like, but it has a ton of benefits for those small groups to be able to access this advanced primary care solution. And then finally, we cannot forget our virtual solution. This is really Marathon Health centers, 4 walls without walls. So the advanced primary care solution with that quality healthcare team that you're able to access virtually or telephonically. We have professionals that are licensed in all 50 states, and it really works out well for a workforce that may have a population in one location, but it then has more individuals distributed around the United States. We find that this solution is really the most valuable when it is accompanied by a brick and mortar, a physical health center solution. Again, we don't expect you all to have these memorized. That's why we want to partner together to understand the goals of your client and to see which solution is going to offer the best access for their population. We can move forward, Leslie, to talk about Indiana. So Indiana right now for Marathon Health looks like 102 health centers. And you may say, Allie, on that map, there are not 102 dots, and that's a good thing because it would be really crowded. But what is highlighted right here is our network health centers. So as I mentioned, that network solution, those brick and mortar locations that are owned, operated by Marathon Health that you can, that clients can partner and join into. So we have 18 health centers around Indiana, and always looking to grow in those areas that we don't have them currently today. There is highlighted there the Indianapolis area, where we have 7 health centers that are around Indianapolis, 465, in areas where you would go, we like to say, where you live, you work, and you play. So we have health centers by movie theaters. There's one by a Kohl's. There's one downtown for those who work downtown or live downtown as well. We're proud to partner with 186 clients and have over 500 team members throughout the state. So Indiana, again, is a really densely populated area for us, but we have other states where this looks very similar, that if you want to understand our solution, maybe in Ohio or in Michigan, where we do have some network health centers, we're happy to get you that information. The same setup still applies, where health centers are where people live, work, and play. Now, our scope of services, as I mentioned before, the solution that fits the population may ebb and flow with the services that they're looking to provide. But I want to go over what the standard scope of services are, specifically for that Marathon Health Network solution for you. So we do our advanced primary care model that you all know very well for the primary care, the preventative care, and those more urgent care situations. So we know we're heavy into cold and flu season right now. We focus on chronic condition management. So the getting a person with diabetes, getting them diagnosed, the care that they need, and coming alongside them working through that process, that is still at the heartbeat of what makes Marathon Health Marathon Health. Mental health, we are in general doing those mental health, the PHQ-9, the GAT-7 exams as individuals come within our health center for those preventative visits. Now, we do have Live Better, which is our additional mental health services as well that we'll talk a little bit about on the next slide. Our network health solution also has an on-site lab, immunizations in those lab tests that are able to be completed at the time of an appointment. I personally had my physical labs done yesterday and was able to go to a network health center and get those done very easily, and the results will go to my provider. We are heavy into flu season, again, as I mentioned, so we've done quite a few flu vaccines around the network as well. Generalized wellness and health coaching. So our providers provide health coaching throughout every visit. We want to make sure that our patients know where they stand with their health, and if they have goals, how we can support them to move their health in that positive direction. We do have additional solutions that emphasize health coaching, chronic condition management, GLP-1s. That's something that we have really expanded this year that I'm excited to share with you on our next slide. Value-driven referrals is a unique, a Marathon Health unique differentiator. And this is how we help employers save money outside the four walls of a Marathon Health Center. And really, this is helping our patients seek high quality, low cost care for those services that, again, we cannot do within our health center. Things like imaging, a specialist referral. And we can walk through that if you have additional questions, how that works, and more about our partner, Garner Health, at a later time if you're interested. Wrapping up our advanced primary care solution, incentive management, something that comes really when you do employer health, making sure people can get their physicals, their biometric screens, and get those incentives completed. On-site dispensing and home delivery. So that's really focused on top medications for chronic condition management and a dabbling of those antibiotics, for example. You come in for that sick visit, you need to get on the antibiotic for your strep throat, for example. We can do that test in the health center, and you can also leave with that medication as well. And then finally, wrapping up is our after-hours support. So we have connected through us a nurse triage line so that on a Saturday, if you're not feeling so great, you're able to call in and get that support that you need. Things like, am I okay just to stay at home and work this out? Or what are my red flags that I need to take the next step and go to an urgent care and ER? So that is our solution to really help curb those costs of ER and urgent care utilization and direct patients in the right way. At the bottom of this screen, you can see the additional services that are available, and those with the asterisk are able to be added to our network health solution. Now, things like a full pharmacy, that is something that we can work through if that's the best solution for an employer group. And the occupational health services, again, think of things in a partnership health center where it may be a little unique, where we need some additional drug screens or things like that. Let's dive into those additional services. So I'm going to go over these really briefly, but again, always happy to dive in, see if this is a good fit for a client and understand really what the goals are. We don't want to put a behavioral health counselor if there are going to be barriers for that those patients to go see them. So this is always a welcomed conversation with us. So let's start with our Live Better behavioral health counseling. So that is a master's level for individual who can be on site at a partnership health center, can be throughout our network location with our Care Anywhere solution that really focuses on that one-on-one counseling. Or couples, families, we do a little bit of that as well. We see things like stress and anxiety, depression, grief, trauma, and we are able to specialize that resource a little bit, the more kind of specialized that solution is with the partnership model. Move Well is our MSK on-site PT solution. So this is something that we are looking to add within our networks, which is really exciting. But we know MSK hits high on our clients' claims list. So how do we come alongside and partner with them to provide that great care? So on-site PT focuses on sprains, strains, tendinitis, the post-fracture, post-surgery care is a big one, and repetitive stress injuries. Again, if it is a partnership setting, an on-site PT is able to really get in the details with that client and understand, is it a manufacturer who's has people who bend over a certain way? Well, how can we come alongside you and help prevent some of those injuries as well? Level Up is our advanced chronic condition management coaching. So this focuses on a few different areas. We have general health coaching, really looking at that lifestyle behavior change, weight loss. So this could be a registered dietitian that's working in a specific GLP-1 program, or some specific chronic condition management programs, whether that be high blood pressure, diabetes, different things like that. Then finally is our Care Anywhere. And I mentioned this a little bit, is really our network health solution, the 4 walls without the walls. So we're able to see those patients virtually, telephonically for that primary care and the chronic condition, as well as those acute visits too. So before I move on, I think it's really, really key to understand that Marathon Health has seen these solutions really bring success to our clients with the partnership with Advanced Primary Care. For a provider to be able to walk down the hall and refer someone for behavioral health counseling, for that chronic condition management, to provide that extra help in a one solution, even sometimes a one building model, is where we really see patients have that success. All right, the moment you've been waiting for, I feel like I should drum roll, is our sample network tiered pricing. Some of you may be familiar with this, but we want to make sure you all have a great understanding of what this network tiered pricing looks like. So this is sample pricing only, bold red, sample pricing only. Every situation will be unique as to what we may need to add in if behavioral health is something that a client may be interested in or fits the needs that they're trying to achieve. So as I walk through this, if there are questions, we're always happy to answer them. So what this looks like is that we are measuring engagement by provider visits for those members that are eligible. And we say that as engagement ramps up, as does the PMPM. So we look at this as a client may start out and start engaging with us, and they may be in that 0 to 15% engagement rate. So that PMPM for all eligible members would be $10 PMPM. Then we're going to look at that on an every 6-month basis and say, okay, maybe they're just at 12% engagement. Then that $10 PMPM remains. If they do flex up, we see great engagement starting out, then it would rise to those next tiered levels. And that is looked at an every 6-month basis. We believe that this allows a less expensive access point for those individuals so that you're paying for access that you're not seeing at the beginning in that engagement. Now, how are additional services within the network is a small PMPM for all of those eligible, and then a per visit fee. So you are paying for those who actually engage within the service. And that varies. Behavioral health, health coaching, physical therapy also follows that as well. Any additional things that I may have missed on this slide, Keisha, that you'd like to call out?
No, I think you did a great job, unless the audience has questions, which we can answer here shortly.
Right. And one thing before we move on, sorry, Leslie, that I always like to cover is that implementation fee. So that fee covers Marathon Health taking on the responsibility to get that client implemented. We know clients are busy, and so we want to be that partner, that good partner to help set up that for the client to take that really the time off of them. So that looks like a custom marketing plan for some clients. Some other clients, it may look like an email campaign for them. It also looks like a project manager, again, managing all of those things, getting claims, getting the eligibility file set up. So making sure that we're able to set up that client for success right off the bat, instead of helter-skelter chaos. We don't like that. So we want to make sure that it is ready to roll at that go live date. All right. And finally, final slide to wrap up before the Q&A. So what happens if there is an opportunity? You've listened to this and you say, I've got a great client. I think this could be a great conversation. Let's move to that next step. So a few things that Keisha and I, with our operations friends here as well, really partner together to make sure that we are providing the best solution for the client to achieve their goals. First and foremost is a census file for a GeoMap. Where do they fit if a network or a hub spoke solution is what they're looking to do? So let's figure out where their members are and what is going to be that right solution. Then a health center tour. Let's go into the health center, meet the provider, understand visual learners here, like understand what that solution is within the health center. And it's a great opportunity to ask questions, especially to that provider, and see really what that day-to-day is like. And then finally, claims data for that ROI analysis. Will this help your client save money in the long run? And we are happy to walk through any and all of those with you, really client dependent. But again, we want to make sure the solution really matches the goals of your client, so that this partnership is successful in the long run. All right, I just spoke a ton, so I'm going to pass it to Greg Howe, who's going to moderate some Q&A. So hopefully we've gotten some good questions that we can help throughout.
Yes, feel free to drop any questions in the Q&A chat there if you'd like. And I'm also going to rely on Leslie here to help me out.
Yeah, actually, we have a little technical difficulty here. We are getting some questions, but I don't think you can see them, Greg. So I'm just gonna read those off. The first one we got was, what does the implementation timeline look for a client accessing the network?
Yeah, Keisha, do you want to take that one, or I'm happy to jump in as well?
Yeah, I can take that. So the implementation timeline for the network is typically anywhere from 60 to 90 days. So pretty quick timeline or implementation timeline for the network, pretty turnkey. And ultimately, the biggest lead time for the implementation is associated with getting the eligibility file. So we must have the eligibility file about 4 weeks in advance of services starting, just so that we can begin communicating with your population, make sure that they are set up in our systems and can register on the portal, and begin engaging as from day one. And obviously that they're well aware of services prior to day one. So usually the average is about 60 to 90 days. We've done it faster before, but that's usually the average.
Mhm.
Thanks, Keisha. Yeah, with all of our network sites, those are all live, active, seeing patients on a daily basis. Because they're owned and operated by Marathon Health, we've got them ready to go to just add new clients in. So again, really that eligibility file, once we have that up and running, and we've got communications out to the members, we're ready to start accepting patients.
And we
We do have
a
another
bit of a-
question. Oh, go ahead, Leslie.
Sorry.
Do you have? I'll let you take yours that I don't have access to, and we've got another one that came, a couple that have come in.
Sure. Yeah, another one that came in. Are there any plans for new network locations in Indiana? How would the consultant work with you guys on determining a new location for that?
Yeah, maybe a two-parter here. Answer. I can answer the first piece, and then I'll let Keisha expand on this. So, when we're looking at all of our network sites and markets, what we're looking to do is make sure that we've got guaranteed appointment availability. So that's first and foremost, making sure that we're adding care team members, providers, nurses, behavioral health or PT as appropriate, to make sure that we've got that appointment availability. And then as we're looking to expand locations, that often is dependent on how those current populations are growing, how those organizations might be expanding their employee size, and then also, of course, any new prospects. And I'll let Keisha kind of talk to a little bit of that process on how we look to add new sites as we bring on new clients.
Yeah, so I think it's a two-part to that piece of the question as well. So as we add new sites into a developed market like Indianapolis, for example, we have 7 sites, and should there be demand to support an 8th site, it's going to be based on the oncoming new lives that we might have. If we are looking to build a new network site in a new market, absolutely. I mean, Ali showed our statewide map. You know, we have 18 network sites throughout the state, but there are areas where we are not currently from a network perspective, and we would like to bridge that gap. So, so we welcome any interest that you think could help drive that. We do focus on markets that we can grow. So one market that we're looking specifically, for example, is Fort Wayne. So we recognize that Fort Wayne is a market that we could potentially grow, and we don't have a network site there currently. So that is definitely an area that we are exploring in 2025. But if there are other areas, certainly reach out to us and we can work with you to determine what we would need in order to make that happen.
Thank you, Keisha.
Okay.
Liz, I'm going to jump in with some of these questions that we've got here.
Sure.
How does it work if a client has employees located in multiple markets? So we absolutely have a lot of current clients that have employees throughout Indiana where we are serving them in multiple markets. And so for the patient, what we want to make sure is that's as an easy of a experience as possible for them to navigate to the health center that makes most sense, whether that's one close to their house or maybe where they work. So we have a couple different ways to do that. In our patient portal, there's a self-scheduling feature. We use some defaults based on their address to identify the market and location that is closest to them. And then we also have our patient support team, which individuals, if they'd like to speak to somebody in person to help navigate that, our patient support team has access to all the locations that an individual is eligible to use, and they can work directly with that patient to find the most appropriate site, depending on the services that they might be needing, or if there's a specific provider that they want to schedule with. Any additional comments anyone would like to add? All right. Got another one here on our slide regarding some of the ancillary services that we offer. We did mention that on-site PT is coming soon to Indy Network. We are working on the timeline. We do not have a definitive date. So throughout the 7 locations, we have multiple sites identified where we are ready to build out a physical therapy space and bring on physical therapists to provide those services. What we do not have in here, and I know Keisha and Allie would be happy to speak more to if you've got interest in that, is we do have a separate pricing model for physical therapy that allows clients to add that service on. And essentially what we have ready is once we have enough lives, we will start bringing on physical therapists to support that service. So we are kind of through the first couple stages, and now we'll be getting conversations with clients to see to gauge their interest in solving for some of those MSK issues that we know are usually sitting in the top 3 of claims spend.
Yeah, so I think for the audience here, if you have clients that have MSK needs, maybe they currently have access to the Indianapolis network, you can always reach out to Greg and express potential interest in that so he can begin kind of working to develop enough volume to start adding physical therapy. So you don't necessarily have to wait for us to come to you. Feel free to reach out to Greg as well. One thing I did want to add before we get another question, if there are more, it's regarding the network. So I know we talked a lot about Indiana and Kentucky because that's who the audience is today, but just a reminder that anytime a client has access to, and this is talking about new future opportunities, if they have access to any network within Indiana or Kentucky, they also have access to all of our Marathon Health networks across the country. So we actually have about 95 sites across the US. So it provides access to maybe adult dependents who are off to college in another state. We potentially have a network site close to them that they can access, or when their members are traveling, there might be access close to them as well. So that is just automatically included. That's not an additional fee or anything like that. So I just wanted to remind you of that. And then in regards to populations that might live in multiple markets, that is a big reason why we request a census file very early on in the discussion so that we can use that census file to determine where their entire population is located, to see where there might be alignment with our sites, whether that be a network or even a hub and spoke location, so that we can maximize that access for those members. So a census file is extremely important in order to recommend the appropriate solution for that client.
Yeah, that's a great call out, Keisha. And actually, just earlier this morning, we've got a Indiana-based client in Carmel, and they have fully adopted the work from home model, and so they have a more dispersed workforce. And just this morning, found out that they've got patients that are scheduling all the way out in our Las Vegas market, Kalamazoo, Michigan, and even all the way out in Pennsylvania. So it really is a nice benefit for those clients that do have that dispersed employee population.
Okay, we've got another question here. It says, my client is putting together an incentive program for the first time. Is Marathon able to help input on that design if my client wants to leverage the network access?
Yeah, that's a great question. We absolutely support wellness and incentive programs. We have a health promotion team that is specifically targeted with helping work with clients on what an appropriate incentive program might look like if they have never had one before, if it's something that they're implementing for the first time. And then we have that built right into our patient portal. So it's a great user experience where patient can log in via their app, or they can go on to actual web-based and see what activities they need to complete, where they are currently, what they've currently completed, and how far they have to go to achieve the incentive. And then, of course, what that incentive is that they're working towards. So absolutely something that we can support as part of our service, and that is included as part of our standard scope.
Okay.
I've just got one more here for now. Everyone, feel free to put your questions in the Q&A there if you have them. Last one for now. Says, I've never done a tour of one of your health centers. What exactly does the tour entail? What can we expect and how do we get that set up?
I can answer that one. So a tour is really a private tour that we have. We like to do those over the lunch hour whenever our staff is on their lunch break so that there is time for you to interact with the clinical team. And it's a great opportunity to physically see the health center. For many who have not experienced Marathon Health before, it's a little bit of a phenomenon. And so it gives them an opportunity to really see and understand how the experience is different than what they have probably experienced in the past. It also gives you an opportunity, like I said, to interact with the clinical team, ask questions. Why do you choose to work at Marathon Health versus IU Health or an Ascension? Many of our providers come from the traditional healthcare world, so they can give a real life example of, their work experience in traditional healthcare versus Marathon Health. You can see exactly kind of how the flow of the clinic is laid out, how it might feel a little bit different. And in my experience of doing tours, it really does generate things that you probably seen it. I know it sounds a little weird, but truly I see a lot of questions really starting to happen as individuals tour the health center and have conversations with the staff. And that really does help the rest of the process of determining if this is something that they want to offer or not. So I do encourage it very early in the discussions so that it can kind of clear up any confusion or misconceptions that one might have. And definitely for a consultant who has never toured one of our health centers, we want you to tour it as well so that you can effectively have that conversation with your clients. I think you touring it and having an understanding really helps you have the ability to explain it to your clients as well for the first time. So please reach out to us, to me, to Allie, to whomever, and we're happy to set that up at a health center close to you or whatever's most convenient.
All right, Keisha, I think we got time for one more question, don't we?
I think we do.
All right, perfect. How is Marathon helping with GLP-1s and coaching? So obviously a very hot topic. It's certainly of interest, I think, with every client we currently work with, and I'm sure that's no different than all of your clients as well. We do have our Level Up service, which Allie briefly mentioned on a slide. And Level Up has quite a bit of customization options. It's primarily focused around condition management. So whether that's weight loss, diabetes, hypertension, we do have a solution that can help approach that. And of course, GLP-1s are a big piece of those chronic condition management. Right? So we've got multiple ways to cover this. I would say maybe in the most basic form, just with health coaching through either a certified health coach or a registered dietitian to help support some of that lifestyle change for those that are using GLP-1s so that we don't have that kind of just ongoing cycle of people on and off of those expensive medications and can potentially have some harmful side effects as well. We also have the ability to manage the prior auth for those, as well as dispense those medications to patients, or we can work with a PBM as well. So again, really based on the client's need, their setup with their carriers, and discussions we would like to be a part of if it makes sense to explore that with us.
Okay. I think we have answered all of the questions. So thank you all for joining. Thank you for participating. Again, if there's anything that we can do to help support you and your clients, please don't hesitate to reach out. We really, really appreciate our partnership with you all. As I mentioned, I think to some of you in an email, Indiana and Kentucky are by far front leaders in advanced primary care compared to other states. And I know that this is a really important part of the business that you provide and the business that you do and how you partner with your clients. So we want to make sure that we can continue to support you well and strengthen that partnership with your clients as well. So thank you for your partnership. Thank you for your attendance. And we look forward to hearing from you in the future. Have a great day.